Okay, good afternoon, everyone. It is 4 o'clock, and actually these clocks actually showing 2 minutes before 4 o'clock, and this is my first experience moderating a session that we are starting before that time. My name is Sonomi Tanaka, and welcome to the session 4, Social Protection and Gender Equality, a new lens to promoting inclusion and empowerment. I have been working in ADB for the last 20 years, and the past few years as the gender chief of Gender Equity Thematic Group of the Asian Development Bank. Now, today's topic is very timely to focus gender equality and social protection. It is my great pleasure to welcome the panelists, which I will introduce to you later on. But before moving on to that, I wanted to just contextualize where we stand now in terms of the nexus between gender equality and social protection. So social protection policies and programs, they have been considered, they have often failed in the past to take into account fully of the existing gender inequalities and also gender differentiated vulnerabilities and risks that need to be assessed well to be integrated into the designs of social protection programs and policies. The good news is that there are signs that gender lens is more applied to social protection programs, and you will get to hear more about good practices later today. At the UN Commission on the Status of Women, or CSW, which is the annual gathering of UN state members and also civil society organizations on gender equality, get together annually in New York. So this happens every March. And this year's topic has covered the nexus between gender equality, social protection, and public services, access to public services, and quality infrastructure. So the issue of gender equality and social protection have been highlighted very strongly, and it is a great opportunity that we are having this panel today. Just so at the end of the CSW meeting, there is an outcome document that is provided, which includes the commitment by the state parties that participate in this event. And there are 3 elements I would like to highlight, which will be relevant to this session. Number 1 is the recognition for the need for applying the life course approaches of women into social protection programs. That's number 1. The second is the recognition that quite often social protection programs, and particularly social assistance, look into household level poverty. But there is a need, when we look at gender equality, gender inequalities, you need to look into inter-households poverty and the power relations and inequalities within the household. So how do we address this issue? And the third issue is on the need for social protection programs to look into more of unpaid care and domestic work of women and girls globally. So this issue might come back during the discussion for this session. And here at ADB, there has been a very exciting moment in preparing this new operational plans under the Corporate Strategy 2030. You heard about it this morning and some other sessions. So we are preparing the new approaches for ADB. And Operational Plan 1, looking at the addressing poverty reduction and persistent inequalities through human capital building. And Operational 2, which is that I've been authoring, which is on gender equality. They both look at this issue, very highlighted issues of the nexus between the gender equality and social protection. So it's a great opportunity, and this session will focus on this topic of how can we do more of looking at existing gender inequalities and how can we address these inequalities through social protection programs? And we will also look into the good practices in addressing gender issues through social protection policies and programs, particularly by addressing life course approach. So without further much ado, let me just sit down and introduce our two distinguished speakers. So ladies and gentlemen, the first speaker is Professor Naila Kabeer from the Gender and International Development, Professor of Gender and International Development at the Departments of International Development and Gender Studies. So Nyla told me that it is important that she's not teaching at gender studies, but also teaching gender at the international development course, which is a very important, and a vice versa. So this is something that we've been also trying to do in terms of, well, as a gender specialist, I've been trying to do the gender strategy and then gender operational plan in operational plan 2, and then there are 5 other operational plans under ADB's Strategy 2030 to make sure that gender elements are fully integrated. So we love this approach. And then she's at the London School of Economics and Political Science. And for many of you, we don't need to introduce her more, but let me just try to attempt. So prior to LSE, she was a professor of development studies at the School of Oriental African Studies, SOAS, and professorial fellow at the Institute of Development Studies at Sussex University. And she remains an emeritus fellow at the IDS. She has extensive experience in research, teaching, and advisory work in the field of gender, social protection, labor markets, poverty, and particularly in the region of South Asia. Professor Kabir has been currently leading an ESRC DFID-funded research project on choice constraints and the gender dynamics of labor markets in Bangladesh. She's on the editorial boards of a number of journals, including the Feminist Economics and Gender Development. And Nyla has been invited to this panel as a 2019 ADB Distinguished Gender Speaker. And I personally, as I said, I'm a great fan, and I used to study at IDS, and it's been my dream come true. And then thank you very much, Nyla, for joining us. And we have a discussant, Mr. Tariq Mahmood, and he is the Director General Cash Transfer of a Benazir Income Support Program, BISP, which has been also highlighted in this morning's session by the Secretary, which is the largest social safety net program in Pakistan. Mr. Mahmood has been a career service servant for the last 20 years, and as Director General DG Cash Transfer of BISP since March 2017, he oversees stipend payments to more than 5 million female beneficiaries for every quarter. And during the last 2.5 years, he led the transition of BISP beneficiaries to a more secure and transparent biometric verification-based payment scheme. So you will get to hear more about this and then more about how BISP program has been empowering women and what's been the key to success. Unfortunately, our third speaker, Ms. Rima Nanavati, who is the Executive Secretary of a self-employed women's association, SEWA, in India, unfortunately, she fell ill. She could not fly to, on Saturday we received this message and we wish her a fast recovery. So we will first hear from Nyla, but before that, I'm sure you have ready already your questions that you would like the panelists to answer later on through the apps, the event apps, and then there's a live Q&A. If you go there, you can put in your own question. I will take up key questions that have come up that you put in, and then ask the panel later on. So, ladies and gentlemen, may I ask, could you join me in welcoming Professor Naila Kabeer, and she'll be talking about a new lens to promoting inclusion and empowerment through gender.
Thank you very much. I want to thank ADB, and I especially want to thank the Gender Equity and Social Protection Thematic Group for inviting me. It's a great honor to be here and speaking to people who have such hands-on experience of some of the things that I study. The title of my talk is about inclusion and empowerment. So let me start by just pointing out what we know, and that is social protection has undergone a series of changes. It began out very much in the structural adjustment years as crisis coping mechanisms, but it has gone on to expand and include risk mitigation, promotion of livelihoods, and for many, a search for transformative measures that will address structural inequalities. It has also gone in terms of modalities from the early safety net approach to now include prevention and promotion, social insurance, active labor markets, and social services. And as you can see, there are many different instruments that are used. And I see that ADB's menu of social protection also includes many of these different measures. Now, one of the things that leads us to this question is looking at what we know about gender gaps, about gender inequalities. And if we look at the World Economic Forum's Global Gender Gap Index, we find that we have seen quite a lot of progress made on the human development indicators of health and education. We see much slower progress on the economic domain, which includes labor force participation, but also gaps in wages, quality of employment, and so on. And even slower progress in the political domain. So the question is, what can social protection do to help to close some of these gender gaps? How can the design, implementation, and assessment How can the way we design, implement, and evaluate social protection help to promote inclusion and women's empowerment? Well, here are two reasons why we should take gender seriously in the design of social protection. One is that if social protection is about addressing people's vulnerability to risk, to threats, to shocks and stresses, we know that men and women experience vulnerability differently. There are gendered forms of vulnerability, and the same set of designs will not operate to address both these different kinds of vulnerability. But the second interesting one is that the impacts that derive from gendered forms of social protection tend to differ by gender. In other words, if we are talking about inclusiveness, women's empowerment, but also those other objectives like protection, promotion, transformation, these can benefit from having a gender-aware approach. Now, inclusion generally means giving people access. So if we use the metaphor this morning, it's bringing everybody under the umbrella of social protection. But simply giving people access is not sufficient if you occupy a structurally inferior position in your society. Empowerment is about turning that access into forms of change that will expand the kinds of choices you can make with your life, that can allow you to live the life you want, to have influence in your interpersonal relationships and in the society in which you live. So empowerment is about expanding the range of possibilities available to people. Now, a very simple notion of a theory of change would say give people resources, it will increase their agency, their ability to make choices, and therefore they will be able to achieve their goals. However, we have been giving women resources. And as Tsunami said, these have not necessarily translated into transformative change. And the reason for that is that there are these structural barriers that are quite powerful, and the short word for which is patriarchy. But patriarchy takes different forms in different contexts, and we need to understand what patriarchal constraints look like. So, by these structures of constraint, I'm talking about both those norms, customs, and practices within the informal domain of families and communities that position women as somehow lesser than men, that give them fewer resources as a result, that give them primary responsibility for unpaid care work while asking men to take dominant responsibility as breadwinners and giving men the access to do so. Whether women also work as breadwinners varies across the world. So in my part of the world, in South Asia, there are very strict controls over women's mobility in the public domain, and as a result, strict restrictions on their livelihood opportunities. Whereas perhaps in many parts of Southeast Asia, those strict controls over public mobility do not apply. But gender constraints don't only apply within the family and the customary domain. They are reproduced by formal institutions. States uphold unequal inheritance laws. Employers discriminate against women on the basis of their gender, or pay them less on the basis that they are having to look after children and families. Trade unions very often focus only on male workers and what men think are bread and butter issues, and ignore some of the issues that women workers might face. So these structures of inequality persist, not only because they are rooted in our domestic culture and so on, but because the state reproduces them. And by feedback mechanisms, I mean that very often people respond in discriminatory ways that are rational because of discrimination. So if the market insists on paying women lower wages than men, parents will invest less in a girl's education because they will think, what are going to be the returns? So any theory of change that relates to women's empowerment has to talk about the process of change that takes place in men and women's lives, that expands women's ability to make choices. But we must also distinguish between practical and strategic forms of agency. By practical agency, I mean you allow women to do better what society expects them to do. By strategic forms of agency, you allow women to start challenging the given destinies that society has ascribed to them. So that simple model of change of resources, agency, and achievements has to be complicated by bringing in these structures of constraint. And that will help us to explain why many of the interventions that we talk about, social protection measures and others, often fail to reach the people they're supposed to reach. And even when they reach the people they're supposed to reach, fail to translate into the kind of resources that will allow them to make choices. And when they do make choices, fail to allow them to make the kinds of choices that challenge patriarchal constraints rather than accommodate them. I'm not very good at this. A couple of other things to remember is that we talk about men and women as a shorthand. There are many different kinds of men and many different kinds of women. There are intersections of race, ethnicity, sexuality, and so on, which differentiate men and women, these binary categories, by specific kinds of constraints that reflect the intersection of gender, class, ethnicity, race, and so on. And that, too, we must take into account when we design social protection measures. And finally, of course, the point that we've made here earlier is that constraints vary over the life course. Vulnerabilities vary over the life course. How girls and boys experience gendered constraints, how they are vulnerable, what they are vulnerable to, lack of schooling, being beaten by parents, and so on, are different, as are the experience of adolescence, adolescent boys and girls have very different experiences of vulnerability, and very often, South Asia in particular, the space open to girls starts to close after puberty because of fears for their reputation and so on. And then how we experience adulthood and old age is also likely to differ. And one point I want to make, which has come out of the research I've done, is that we need to be aware of the way that vulnerabilities vary in the later years, because it makes it increasingly imperative to address vulnerability in the earlier stages of the life course, in the working years of people's lives and in adolescence. Oh, I think I'm going to need you to do the first. Okay. Okay. So this is ADB's recognition of a life course approach. And as you can see, it recognizes how these gendered vulnerabilities affect people at different stages of the life course. Could you move on? Now, what I'd like to do is start out by asking why it is that the interventions that we propose don't always lead to change. First of all, there is a question of exclusion. For instance, it is assumed once you pass the age of 60, that you're incapable of work. So a lot of livelihood opportunities are closed off to people who are over a certain age. Then there are the biases. When you design agricultural extension services, you design them for crops that are associated with men, staples. You ignore horticulture. You ignore livestock. So there is a question of biases, and then there is irrelevance. And here I'll give you the example of 6 randomized control trials that were carried out in different parts of the world. And the conclusion was there was modest progress. But what we should bear in mind is of the 6 randomized control trials, Morocco, Ethiopia, take-up varied between 17 and 30%. The vast majority of people did not want microfinance. So you're offering them an intervention that is not relevant in a remote rural area or in a violent border area and so on. So there is also the issue of irrelevance. Why do the resources, when they do reach people, fail to translate into capabilities? One is, of course, men and women start out from very different initial conditions. Supposing you offer the same agricultural extension service, but women have far poorer land, far poorer quality land than men, it's very unlikely that they will be able to translate that training. Secondly, of course, time and mobility constraints. When we talk about women having primary responsibility for childcare, for family care, when we talk about the restrictions on their mobility, then to offer them training or to require them to sell their goods in the markets is going to be far more difficult for women because of these constraints, and you have not factored that in. Thirdly, what Tsunami talked about, intra-household dynamics. If men can forbid women to go to meetings, if men can forbid women to open up a business, if men can forbid women to use their resources as they wish, then the incentives for success are very limited. And finally, what I'm calling holes and gaps in opportunity structures. Supposing you train people in various skills and there's no market for it. Without a demand, what is the point of creating a supply? And many of the interventions that fail because there was no demand. But let's now go on to looking at some of the better news. And that is where I want to pull out how investing in a gender-aware approach to social protection, whether it is along the lines of men and women or women only, can have gendered impacts which are important for us in the name of inclusiveness. Let's take the elderly. We know that the world is getting older. We know that aging or silvering is proceeding faster in Asia than in many other parts of the world. We also know that women in the older age groups are poorer. A number of reasons. First of all, there are many more women in the older age groups because they live longer. Secondly, many are widowed because they marry men who are much older than them. Thirdly, many of them have not worked in jobs which give them pensions. Fourthly, those who have worked in jobs which pensions have done so very intermittently, so their pensions are very poor. And fifthly, most of them work in the informal economy where there are no pensions. So for that reason, we have seen an expansion of social pension measures, non-contributory pensions. And we're seeing them spreading in Asia. But the research, and this is why the evaluation is so important, because it teaches us what comes out of our interventions. And the main research that we've seen has come out of South Africa and of Brazil. And what that tells us is that men and women use their pensions differently. Women, older women with pensions are much more likely to have their grandchildren living with them. Female pensions are much more likely to lead to education of grandchildren, particularly of girl children. Female pensions are much more likely to finance job search of their daughters and to lead to migration. Female pensions are also more likely to increase the health of grandchildren. So this doesn't mean you deprive men of pensions, but you have to be aware why it is important to make sure that they both get fair pensions. However, pensions are not enough. The reason is the world is getting older. There will not be enough money to finance all the social pensions that will be needed. And therefore, what we need to make sure is that people arrive in their old age not completely reliant on social pensions, which are often quite small. They need to have saved in their working years. They need to have accumulated assets. And one thing we also find out is the elderly are subject to violence. That this pooling, these good results for their grandchildren may not often be voluntary. And if an elderly person has assets to bequeath, the likelihood that they will be treated better is also higher. And that is why it is important to start investing earlier in economic capabilities of the working generation. So let's then look at some of the interventions. We talked this morning about conditional cash transfers. There are also unconditional cash transfers. These are largely directed to women, so there's no comparison here between how men use it and women use it. But what we do know is these cash transfers go far beyond their immediate objective of investing in children's health and education. That they, again, very often women use them to invest in small assets, like small livestock. They also use them to finance migration, the Progressa story. Long-term evaluation of Progressa, I'll call it Progressa, finds that the daughters of Progressa were likely to find jobs higher up the occupational hierarchy than their mothers. It also found out that these provisions closed the gender and ethnicity gap in Mexico in education. And in Brazil, Bolsa Familia, which is a practically unconditional cash transfer, for many of the other Brazil, the Black Brazil, the Afro-Brazilian Brazil, who are amongst the poorest people in Brazil, it was their first contact with the state. It was their first reminder that they were citizens of a larger entity called Brazil. So it inculcated in them a sense of belonging. But one interesting thing I'd like to share from the Progressa evaluation is, as we talked earlier, these conditional transfers are often accompanied by training. And so when women were asked about the training they received, they asked why the training only focused on their reproductive responsibilities. Why did the training not also include livelihood skills that they would be able to utilize? And why were men not included in the training in order to teach them about their paternal responsibilities and about how to reduce violence against women and children within the home? So there was a lesson there about the kinds of training that we give and who we give it to. A second set of interventions, I talked earlier about microfinance that went nowhere, microcredit that nobody wanted. But when we look at the longer established microfinance programs, like BRAC, what we see, there has been an evaluation of a number of microfinance institutions in Bangladesh over a period of 20 years. And it has been found to reduce poverty. It has also been found that when women borrowers get the money, that they're much more likely to invest it in their children and in the health and education of their daughters, closing the gender gap. So the problem with these short-term trials is there's no opportunity to learn. We need a longer period of time for an intervention to adapt to local circumstances and then be able to yield, to harvest the proper yields. But while microfinance may help those with the moderately poor, those with some capacity for enterprise, for the very poor, savings-led self-help groups have been found to be more effective. And this brings, innovated in India, this brings women together, 20, 30 women, who agree to save regularly and pool their funds and to use that as a source of loans. And what that does for people who have not been accustomed to thinking ahead, planning ahead, it gives them a sense of the future, a sense of saving for the future. And of course, in India, these are now linked to poverty lending. But these self-help groups are more than just saving mechanisms. Again, the evaluations of self-help groups, none of this applies to everything, right? There are lousy self-help groups and there are good ones. So looking at the good ones, we find that they expand the circle of acquaintances that women have beyond their immediate family and kinship. They involve them in collective action, going to the local government, local officials, demanding water and other necessities on behalf of themselves and their communities. And it gives them a sense of solidarity which normal customary kinship structures don't normally allow them to have. Public works programs, I'm going to look at the National Employment Guarantee Scheme in India, which guaranteed jobs to anyone who wanted them, but built in various measures, such as equal minimum wages for men and women, such as work provided within, not too far from the home, creches for any program that had more than 5 women, and so on. It also allowed either the local officials or NGOs to audit the program, to make sure that people were getting their just entitlements. And here we find, although there was a quota in the program for 30%, nationally it far exceeded 30%. Many more women took up these jobs because they don't have that many opportunities. And these jobs also led to a rise in low-skilled agricultural wages. And that rise was higher for women than for men. Now, from the farmer's point of view, perhaps that wasn't news, but we do know that agricultural wages are amongst the lowest in the economy. So any kind of rise in them should be welcomed on the grounds of justice and equity. The other point to make is I found in my research that women often prefer public works programs because there's some degree of rules about them, there's some limits to how badly you can be treated. And they prefer to work on a public works program than having to negotiate with private landlords and private contractors where there are no limits. The other point is that women who participated in the NREGS were also more likely to educate their children and were also more likely to educate their daughters. So the education effect was stronger for the very poor and was stronger for girls, and daughters of the NREGS were likely to perform better in school. When we talk about youth, younger people, very often on-the-job vocational training appears to be one of the more successful. And some of these come out of Latin America, Colombia, Dominican Republic, and so on. What makes them successful is they made provision for women's unpaid care responsibilities. They provided transport costs, stipends for childcare, and so on. So many of them actually managed to get 50% participation of women. And the evaluations tell us that the impacts in a number of these countries were stronger for women. They were more likely to find employment, more likely to find formal sector employment, and it closed the gender segregation of the labor market in certain contexts. Another example, which I think of as on-the-job training for the very poor, is what you will be hearing about later on in this conference. It's called the graduation program. And this, again, developed in Bangladesh, but it has been trialed across the world. And essentially, it gives small assets like livestock or fish or whatever to women in extreme poverty, but it combines it with training, a cash stipend for 2 years of the life of the program, intensive mentoring. BRAC likes to call it hand-holding. I find that a bit maternalistic, so I think it's just intensive mentoring, where staff come and visit you on a daily basis, on a weekly basis, discuss your problems, help you to make a planned future. The evaluations of these have generally found extremely positive economic effects, less positive on women's empowerment or decision-making, except the one we studied in West Bengal. And the reason I think the one that we studied in West Bengal actually led to women's empowerment is it added a self-help group component to the BRAC model. And that self-help group model was extremely important in bringing women together on a weekly basis to discuss their problems, to take up action, and so on. So I think of the BRAC graduation program as on-the-job training for the very poor. You give them assets, which means they stay in the program, but you provide them with training. And so they learn about managing their assets over a period of 2 years through trial and error. And that may be one of the reasons it has been very successful. How long have I got? 7 minutes, okay. Multi-stakeholder approaches to labor codes. Now we're moving to formal employment, global value chains, and the whole arena of how does one improve working conditions. We've had private codes of conduct, very selective impacts, very little impact on issues around freedom of association, sexual harassment. But I've been working on with the ILO's advisory group on better works, and that has been monitored since the programs began in a number of countries. And the good news is that it is having an impact. So sexual harassment has gone down in a number of places. The gender gap in wages is closing. In some places where sexual harassment hasn't gone down, reporting of it has gone down, or has gone up. So what is it about the Better Works program? It is not a buyer-driven codes of conduct. It is social dialogue between factory managers, workers' committees, and trade unions. And I think, again, it's bringing people together in a very much more collaborative effort to improve working conditions. Finally, going on to adolescents, one interesting fact, which goes on back to my point about the holes and gaps in the opportunity structures, is there was a conditional cash transfer program that experimented with in Malawi, lasted 2 years. For those 2 years, adolescents stayed in school, avoided risky sex, sexual behavior, transactional sex, and so on. Fine, it looked like a success. The moment the program ended, that behavior changed. It went back to marrying very early, having children far too early, and all. And why? Because once that money had gone away, there was no other way to earn a livelihood. So what else were you going to do? So the message, I think, from that is that cash transfers on their own is not going to change things if there isn't a broader structure of opportunities. And here, I think, the adolescent learning efforts, which create safe spaces for young girls to come, discuss their problems with their peers, to learn about livelihoods, to learn about savings. This has been trialed in Uganda and been extremely successful. Younger adolescents have started their own enterprises, they're saving, they feel far more empowered, they're much more optimistic about the future. And once again, it's that group element that I think has made the difference. And that group element was missing in the conditional cash transfer in Malawi. So all of these are important, but they are all project-driven. And I think what we are looking for are programs and policies. But social protection cannot substitute for everything. So I want to end by talking about some broader lessons. And that is, when you go for these trials, please remember how short-term they are. An alternative approach is problem-driven iterative adaptation, which you work in the field, you learn what you get wrong, and you adapt. And that requires time for you to get it right. Secondly, structural responses. There are individual childcare creches and so on, but really women's unpaid responsibilities requires statewide provision of affordable childcare. It requires infrastructure which will make mobility easier. It requires electricity, piped water, all of these things which will make the burden of unpaid responsibility easier for women when you're not being able to redistribute it on a fairer basis with men. So there are structural responses to time and mobility constraints. I've emphasized again and again the importance of social solidarity. Asking women who are at the receiving end of patriarchal violence and constraints to do change on their own is asking a lot. Bringing people together, whether it's in these girls' safe spaces, self-help groups, different kinds of worker associations, makes change easier, makes it easier to challenge unfair practices. The state can do a lot. Minimum wage legislation in Brazil was very important in bringing more women into the labor market and closing the gender gap in labor market. Formalizing part-time work for women in Argentina allowed more married women to come into formal employment. Instruments like CEDAW and so on all have had an important role to play in creating an environment where change can take place on the ground. And finally, of course, if we've got these holes in the opportunity structure, then all the skills and all the assets in the world is not going to compensate. So somewhere we need to rethink our growth strategies, and I know that ADB is on that path, to make employment generation, rather than maximizing growth, central to the strategies that we employ in macroeconomics. Thank you.
Thank you very much, Nyla. May I now call upon DG Mahmoud on the BASP program, and it's titled, it is titled as Social and Financial Inclusion, Lessons from BASP, Pakistan. Thank you.
Bismillah ar-Rahman ar-Rahim. Distinguished guests, ladies and gentlemen, my presentation will focus on social and financial inclusion for women and experiences from Benazir Income Support Government of Pakistan. The sequence of presentation is as flashed. Measures that we have taken in Benazir Income Support Program for social and financial inclusion of women. Few success stories, if I have time, I will share with you, and impact evaluation results and future policy interventions. The preamble of the BISP Act provides for social and financial inclusion of the underprivileged segments of the society. The main cornerstone of BISP program is the targeting. Phase 1 was community or parliamentary phase targeting, in which there was no scientific basis. So we switched to phase 2 targeting, which was more scientific basis. We conducted a national poverty scorecard survey and developed a national socio-economic registry based on proxy means test. This led to the development of an eligibility criteria under phase 2, which is the cornerstone of the social and financial inclusion of the poorest of the poor women. The eligibility criteria is an ever married female with a valid computerized national identity card. Through this eligibility criteria, we were able to make 5.2 million beneficiaries as eligible. And because of this CNICs, we politically empowered the woman, even the women in the culturally constrained or culturally conservative regions. The eligibility criteria is being further revised in the phase 3 of the targeting that we are further revising, and will include unmarried females and transgender. We have also made transition in the payment instruments. We started off with Pakistan Post, a money order system from 2008 till 2011. Then we, because of the issues with the Pakistan Post delivery mechanism, we switched to banking system. And the payments were made through debit cards since 2012 till 2016, when we introduced biometric-based payment withdrawals by the beneficiaries to reduce leakages and middleman culture in this system. Women receive the cash stipends biometrically themselves, whether it is an unconditional cash transfer or conditional cash transfer. And currently, 90% of the beneficiaries receive their cash grants through biometric-based payment mechanism. Another important aspect is the BIS beneficiary committees, which we use as a social mobilization platform in Wasila Taaleem conditional cash transfer districts. So far, almost 100,000 BBCs have been constituted for the purpose of social mobilization. Every BBC has a woman leader. The main focus of the BBCs is to impart trainings to the beneficiaries on different areas. First of all, encouraging them to send their kids, whether a boy or a girl, to school for education, building financial literacy, any issues that they face in the biometric-based withdrawals, trainings on nutrition, and on general topics relating to violence against women and family planning. The awareness campaign through these BBCs has led to a major primary school enrollment of 3.2 million out-of-school children. Another major instrument of BIS for financial and social inclusion is that BIS data sharing policy or protocol. We share household-related data with other federal government ministries, divisions, provincial governments, non-government and private sector organizations to easily identify the women for their inclusion in different initiatives. There are a few success stories. For instance, Ghulam Bibi, Fateh Jang, Punjab. We were poor and used to break stones. BIS stipend empowered me to support my family, and I used this amount for the education of my son and medical needs of the family. Another woman, Taj Bibi Havelia, Khyber Pakhtunkhwa. After the death of my husband, I was left alone with my small children to make both ends meet. Then BIS stipend supported me to raise my children and support their education in a respectable manner. Rehana Begum from Jhalmaksi, Balochistan. My husband works on daily wages and no permanent source of income exists. BIS stipend improved our living conditions and children were also able to join school. Gamsali Gizar, Gilgit-Baltistan. Unfortunately, my husband got blind and was not able to work. I used to work in the field to make ends meet. BIS stipend improved my life and gave me confidence to change my destiny. The impact evaluation has been carried out by Oxford Policy Management, and as per the results of the impact evaluation, financial savings have increased over the period from 2011 to 2016 from 9% to 13%. Majority of the beneficiaries retain control over how the BIS cash transfers is normally spent. 76% decided on how to spend it herself in 2016. Current enrollment in out-of-school children between the ages of 5 to 12 has increased. There was also positive impact on the mobility of beneficiary women, with more likely to travel alone by 12%. And there is 30 percentage point increase in women who are likely to vote. In the long term, as per the impact evaluation results, BIS payment allows beneficiary households at their own discretion to make desirable investment in nutrition, education, health, and productive assets. Future interventions include opening of a savings account for each beneficiary, establishment of BIS beneficiary committees in further 50 more districts, and by 2022 in all districts of Pakistan. Increasing the stipend amount for the girl child, for encouraging the parents to send their girls for schooling. Increasing primary school enrollment and retention through increasing the stipend amount. Nutrition and immunization program for the pregnant and lactating mothers to address the issue of their vulnerability of diseases and malnutrition. And finally, the live NSCR registry. Since the current registry is static and we cannot exit and enroll any beneficiary whose welfare status has upgraded. I was told also to brief on the life cycle approach. We have this targeting mechanism through which we identified the beneficiaries, and we, after running the PMT, 16.17 was identified as the cutoff score for making the cash transfers to female beneficiaries. But we also have an appeals criteria, which is between 16.17 and 20, and through which we also pay to the elderly women who are of 65 years age and above. Besides that, we also provide stipends to young girls of beneficiaries between the age of 4 to 12, and this is rupees 750 per quarter. It comes around US dollar 4.3 per quarter. So thank you very much.
Thank you very much for the both presenters. And Nyla, you highlighted on the different pathways to translate the intervention into resources and a resource into capabilities. And I think it's a very important concept, and highlighted some of the examples from different countries, particularly focusing on South Asia experience and also Latin America, the various experience and good practices. And thank you, Deji Mahmood, on highlighting also BISP experience. I'd like to start the question by asking Deji Mahmood, because BISP has a series of success, and in your presentation on the impact evaluation, some of the important things that we thought should be highlighted were not there. I mean, there's a series of a great gender impact, women and girls empowerment impact, but one thing was that increase in vote by women. Another thing was increase, what was it? Mobility. So if you could highlight a little bit to share with these colleagues who are interested in how the BISP has resulted into the more women empowerment impact.
First thing is the computerized national identity card, which empowered women, politically empowered women, to be the part of the voting process. This was particularly important for those areas where we have cultural constraints, but even there, the beneficiaries who have the CNIC are now part of the voting process and have been mainstreamed in the political process. Second thing is the girl child education through Wasila Talim conditional cash transfer. And through the conditional cash transfer, we have been able to ensure that the main focus has been on girl child, and the impact evaluation results show that 81% girl child have been retained in the primary school education through BIS stipend. Thirdly, through biometric verification system, we have ensured that the woman beneficiary herself receives the money, and she is the custodian of the money herself, and the choice is with her on the way or the mechanism that she adopts to spend that money.
Thank you very much. So I will start taking up the questions that came from the floor already, and then ask the questions to the panelists for your answer. So let me start with both of you. So we have this question that in an equal society where there are structural barriers for women to participate in social protection programs, what do you think is the role of government to reduce these barriers? So I think I can address this question to both of you. Nyla, would you like to start?
Is this on? It's on. You know, social protection is for those who are the most marginalized and the poorest. The reason we have added social assistance, active labor market policies, and so on, is it wasn't happening by itself. To reach out to vulnerable people, to reach out to people who are put in a subordinate position by their societies, they are put in these subordinate positions by the normal operation of their societies, by the normal operation of markets, by the normal operation of customs and kinship. So it requires an institution whose mandate is to look after the welfare and rights of all its citizens to intervene. So it is the state that must play a leading role in saying that we need a far more democratic society. We need to enable all people to participate in the processes of growth and to benefit from the processes of growth. That is not going to happen by itself, because if it did, it would have happened. It has taken the state to come in and steamroll certain of the more obstinate aspects of patriarchal constraint.
Thank you, Professor Nyla. Government of Pakistan, through BISP, has ensured that the cultural barriers or the geographical barriers which obstruct women inclusion or women empowerment are to a certain extent removed. The eligibility criteria, as I mentioned in my presentation, was a major factor in encouraging women to come forward and register themselves for the CNICs. So it's basically, as Professor Nyla said, that the state intervention that is also required to ensure that if there are cultural constraints or barriers or biases, then the state has an equal role to facilitate such interventions which will promote inclusion and empowerment of women.
Thank you. There's another question. So we have been talking about the social protection, employment, linkages, but why not reforming existing social protection systems by reviewing the employment requirements of a social protection program or creating employment status for informal domestic work? And we've talked about unpaid care and domestic work as well. So would that add value to the work done by women? So would you like, Nyla, to answer that?
If I understand the question, it's why don't we reform current social protection measures in a way that acknowledges? I think we should. I think, there has been attempts, say, in South Africa, to extend the public works program into care in the community in order to relieve some of the burden that women on their own are having to face, looking after children or HIV patients and so on. There are many different ways in which we can, and it's the point I raised at the end, change infrastructure, change utilities, all of which will lessen the burden of care, of unpaid care. But I think that real challenge is how does one redistribute the burden of unpaid care within the home? Rather than just lessening it, what can we do to persuade both men and women to share these tasks more equally within the home so that they can participate more equally in the market? I'm not saying that's easy, but I'm saying that that is really a very logical solution.
I think the lessons that we have learned that if the beneficiary herself is given cash, she has the independence to spend it on her family and also her kids. If it is given, the extension that is given to her, she needs that protection, and through the state we can ensure that this is institutionalized. We have already emphasized girl education, but we are through our revised criteria pushing unmarried women, and we are also looking at including the elderly woman, as pointed out in the presentations as well. So extending the social protection is basically state's own vision where it wants to go and where it wants to take the organization, and it can be done with the will and continuity.
Nyla, you wanted to ask?
Yes, I think I didn't pick up the question about domestic workers. And I think, one of the most unexpected success stories of recent times has been the ability of domestic workers to organize and get recognition from the ILO for the value of their work and the rights of their work. And that could not have happened without that kind of social solidarity and mobilization that I was talking about, and that I'm very pleased that BISP is also recognizing as important. I think these platforms you're discussing, I think they need far more research, because I think some of the empowerment impacts that you're picking up may also be traceable to the fact that women have this platform and place that they can discuss and mobilize. So I think, for me, for domestic workers, okay, the convention is only the first step. ILO conventions are very unevenly implemented, shall we say. But having that law, having that convention, I think is a very good starting point.
Thank you. I'm moving on to another question. This is for Pakistan. So Pakistan is among the lowest tier of the gender gap index, global gender gap index. And is present social programs enough for uplifting the status of women? I mean, it's a big question. And the BISP is really contributing towards that. But the question is the existing program sufficient? And what are the other mechanisms that need to put in place?
Existing mechanism may not be sufficient, but BISP has done 5.2 million is a significant number, and if you have a family which includes girl child and even male child, this is a significant number which the government is supporting, and with more budget and with new survey results that we will have, probably we are targeting more population, so we will have more. We are looking at more beneficiaries which will come in the safety net and social protection framework. But the thing is that BISP is not the only organization that is looking at these initiatives. There are other organizations as well, like Baitul Mal and Zakat, departments, then we have provincial departments as well. So there needs to be a synergy despite the fact that we are, as per the indicators, we are low, but there needs to be synergy, and also looking forward with the new database or the survey, we will have a much more ways to incentivize the female population.
You also touched upon a very important point of data. Nyla, you have anything about data collection, the importance of that, particularly sex disaggregated data that is within the realm of social protection, and has that been, has there been any good practices? And of course, the business is a huge, 5 million women and girls. So, Nyla, you have any other things to share?
Well, I think, as you know, one of the huge gaps that the MDGs and now the SDGs has uncovered is how little disaggregated data we have to actually monitor what are fairly gender-aware targets, goals, and indicators. But on the subject of social protection, I really am a great advocate for evaluation, because I think there are two reasons we evaluate. One is to hold accountable that people have done what they set out to do and that they have tried to achieve. They can't guarantee. But the other is to learn. And it is only by evaluating programs in such a way as to document successes, failures, and limitations that we can improve practice. So I think it's very, very, the big data story is there, but also program evaluation is hugely important.
Thank you. We have a few other questions on the system, but since there are some people who haven't had an opportunity to actually use this system, I'm wondering if there are any questions from the floor who we would like to ask, or the sharing of your experience. Anyone who wants to come forward, please. There will be someone with the microphone coming. Sorry, I don't see the microphone. Are there any raise of hands, and then we're going to arrange the microphone. Gentleman over there. We'll take a couple of them first. Anyone else? Okay. Could you stand up? Could you stand up and then
Yes, sure.
identify yourself briefly?
Yeah, my name is Vimalabira. I'm from Sri Lanka. This is not a question, right? I need to get some clarification and opinion from you. Yes, both of you, it's a good presentation, and we need to support the vulnerable people like women. We need to get them on board. But, sometimes, providing assistance may stimulate the dependency culture. So how do we, providing such kind of assistance for vulnerable people, what would be the role of the government and all other, the stakeholders to get them on board, to the development process, right? So what kind of opinion or, observation you see from other countries?
Thank you very much. There's another hand here. If you can bring the microphone.
Thank you.
Could you stand up and identify yourself, please?
Hi, I'm Ritu Verma. I work at the ADB. Nyla, you mentioned, that gender is not just about the differences between men and women. It's also other forms of difference, class, ethnicity, caste, et cetera, et cetera. I'm wondering, do you think social protection has been able to keep pace with some of the global changes that have been happening? So I think one of the biggest stories in the last few years has been widening income, wealth inequality between the ultra-rich and the rest of the world, the 0.1%. And so I wonder, how can we redistribute, first of all, and how can social protection kind of address, I don't know, are they wide market failures? The inability of GDP to internalize, let's say, women's unpaid work, so how can social protection bridge some of those failures?
Thank you. We'll start with these two questions. Mr. Mahmoud.
About dependency syndrome, creation of dependency syndrome, I would comment that we are targeting the poorest of the poor segments of the society. But we are not oblivious of the thing that we shouldn't be creating a dependency syndrome. But we should also realize that these are ultra poor people. So what we do is that besides providing them cash transfers, we also design schemes and interventions whereby we impart them skills and also give them microfinance opportunities. So this is done, but the thing is you have to see the overall economic conditions and the other interventions that you provide to the poorest of the poor. But still you will need a hand-holding for the ultra poor till they come to that stage where they either have the skill set or the opportunities to come out of the poverty trap.
I think a great deal of what I said in my talk was actually to challenge the idea of a dependency syndrome. I don't think we have that much evidence from the global south that the moment you give people some help, they become dependent. I don't think they trust the government enough to be dependent forever. Also, I think even people who are given small stipends try to save, try to buy productive assets. You never give them enough for them to have a decent life. What you're trying to do is give them a step up the rung so that sometime they may be able to have sustainable livelihoods. What we are also seeing is that putting money, in the case of BISP, into the hands of people who had no other kinds of livelihoods is actually good for the for the human capital of the next generation of citizens. So even these women who are not necessarily working are using the money at their disposal in very productive ways. So I think the dependency idea comes from some other place. But the literature, the evidence, the evaluation from the Global South suggests that there isn't such a thing, that people want to get decent livelihoods. They want to get out of poverty. And to Ritu's question, social protection is not a panacea. You are talking about a systemic tendency towards increasing inequalities. And you're talking about redistribution from those who have towards those who have not, so that those who have not will catch up with them. It's not going to happen. There will never be that kind of, people will not tolerate, those who have the political power will not tolerate that kind of redistribution. But what we can do is try and use the social protection instruments we have to give people a better sense of themselves, their self-worth, their citizenship, their rights, so that they can perhaps start mobilizing to put pressure. I think the obscenity of inequality has been recognized by the most mainstream of institutions, from the IMF to the World Bank to everybody else. Whether they have the clout and the capacity to shift the balance of power sufficiently to start reversing these trends, your guess is as good as mine, I think.
Okay, so I'll take up a next round of questions. Prabjot, are there any other hands from on the other side? No? Okay, we'll start with the Prabjot.
Thank you, Sonomi. I'm Prabjot from India Resident Mission of ADB. I'm a gender officer. And thank you so much for your presentation today, Professor Kabir. We agree that social protection systems have, the potential to transform social and gender dynamics in the nature. I'm just wondering, for example, if we take the NREGA program of India, and we understand that we have to reach a certain kind of population, but how do you think having a quotas for women there has helped reach out more women? How significant is to have a specific target for women in these kind of programs, because we are often challenged on these aspects, but I think it's important to know why, because we, for example, in NREGA 33% quota for women is there, but we are achieving 51. So, but again, as a gender person, I understand that we need to have specific quota for women. Or for example, in the BISAP program, how important it was to have a specific target for women and why it has fetched the results that we have today. So that's my question. Thank you.
Any other show of hands? Okay, so we'll start with this question. I would also like to add that, to add to what Prabjot said, that the ADB, we put emphasis by putting in the female quotas, and then not just in the people who have access to the benefits of social protection, but also supporting women into the governance structure of the social protection programs, the decision making and participation in meetings. But these may often end up in adding more time poverty of women who are very busy, and in the end you can't really meet this participation target for females because they're so busy. If you have any suggestions for how to overcome that, that would be also great. So with these questions on the quota, Nyla, would you like to start off?
The history of social protection, and a great deal of it, has been that it was very male biased. And I think today we heard that the ADB social protection programs so far are also quite male biased. I think having a quota, and as you say in India, it far exceeded the quota. Clearly, there was a hunger amongst very poor women for some kind of guaranteed employment. They didn't want to sit around at home doing nothing. But having a quota is a signal to say, don't forget, there is another half of the population or whatever that should be included. And in places where this is not taken for granted, or where the social protection program on offer doesn't specify it, and those 6 RCTs I talked about of microfinance, 2 or 3 of them were directed towards women, 2 were for both men and women, and men monopolized it. There was no quota, men monopolized it. So as long as those power asymmetries continue to function, a quota may be either a symbolic or a real signal to people to say, please be a bit egalitarian in your approach. I'm not, there's a chicken and an egg issue here. If women do not participate in decision making and design, the danger is we will end up with programs that continue to exacerbate their work burdens. I think the reason why many women may refuse to participate is because they don't know what's in it for them. There are a lot of empty exercises of consultation, empty exercises about participation, and perhaps they know that. So I think if you want people to participate, I think you have to give them a very strong promise that their voices will be heard and taken into account in designing the program, assuming that the program is relevant to their needs.
Thank you. The point is very apt, and the targeting that we did and the eligibility criteria was basically an egalitarian approach in which we plan to encourage the women to be masters of their destiny. And for the broader perspective at the policy level, you have to involve women in the policy-making decision, which, for instance, at the government level, we have increased women participation in civil service exams. So there is an increased quota for the women participation, but it comes with more of participation by the women at the policy level, and legislation at the national level and the provincial assemblies will encourage such inclusion of women in and their mainstreaming. At the micro level for the social protection measures, I think BISP has shown a lead in an egalitarian way. Thanks.
I wanted to add one thing, and that is, it struck me that, the last of my PowerPoint is what is missing. And one was about, are we measuring what we set out to measure? But the other was, how do we factor men into programs that are intended to empower women? So when we talk about BISP, and we're training women and we're telling them about domestic violence, where are the men? And that's what the progressive women said. You're training us about our reproductive roles. Tell us about livelihood skills. We do not want to be dependents. But at the same time, can we not bring men in to tell them about the harm that it does to a family to have violent forms of behavior, and how that leads to the intergenerational transmission of male violence within the family? So I think there are areas where we're missing out by not targeting men far more in areas that are typically associated with women.
You raise a very important point of violence against women. Sorry, I need to go back to Mr. Mahmood. So violence against women, what is the BISP? I know that there are awareness program on this as well. How does this issue tackle within the program?
What we do is we impart awareness sessions through BBCs to the women beneficiaries to be aware and to be aware of their rights. And besides that, we also have at the headquarter level, at the provincial headquarter level of BISP, we encourage such training sessions and also seminars for encouraging women to have be more assertive in their role. But I agree with Professor Nyla's suggestion that in the training sessions that we have in BBCs, the question that has been raised that the men have to also be included in such sessions so that their role being an equal partner has to be taken in the right stride.
It's very encouraging to hear that, and then ADB would like to also follow up on you on your words on this, and it's actually quite increasing these days to pay attention to men and boys to participate in the violence against program, whether it's within the social protection or livelihood schemes or any other programs. Now, we are coming towards the end of the session, but I would like to ask for the final opportunity to ask for your final remarks that you wanted to conclude, or something that you feel like you haven't said enough. Professor Kabir, would you like to go first? Or you feel that you you had enough opportunity?
I don't think I have anything to add, except that I hope that ADB, we come back, perhaps, both of us, in a couple of years' time, and find that huge progress has been made on a gender-inclusive social protection umbrella.
All right, okay.
It will stand as a beacon to the rest of the world.
Oh, okay, right, okay.
I want to thank about the opportunity that was given to me to present BISP from the perspective of social and financial inclusion of women. Probably BISP was missed in Professor Nyla's presentation, but at least I had the opportunity to to point out the essential features and the success stories of social and financial inclusion of WISP beneficiaries through what we have done through WISP and the government of Pakistan has done over the last 10 years.
Well, thank you very much, and thank you very much for the participants, and a big round of applause to the panelists and then yourself. Thank you very much. Now, you're all invited to the cocktail that will be happening outside, so thank you very much, and it's been a long day, but please enjoy the cocktail. Thank you. We'll see you tomorrow.